Hello, and welcome to my podcast. My name is Eric Davies, and today I'm going to be talking about a disease that has been on the rise in Pennsylvania for the past decade. I will be talking about the disease chlamydia, and to help me, I have spoken with 3 different doctors from the area. The STD chlamydia is so common, it's likely on your walk across campus today, you've passed somebody who's been infected, since 1 in 50 20 to 24-year-olds has had it.
The rate of the infection is rising all over Pennsylvania. From 1995 to 1997, the chlamydia rate of infection in Cumberland County was 3 in 5,000. By 2004, it more than doubled. The CDC states young adults are most at risk.
Todd Peterson, I'm a medical doctor, and I'm the medical director at the health center here. I can tell you we do see at least probably 2 or 3 diagnoses of chlamydia a week that we see here, but not everyone comes to treatment here.
I'm Dr. Baxter Wellman, family practice in Shippensburg, Pennsylvania. There's cases that are silently being passed because someone may not have active symptoms when they have the infection.
The passing of this infection through these silent cases could be one reason for the rising rate.
OBGYN Wayme Connor had a few things to say about the disease.
Mutually monogamous relationships are less risky than if you have multiple partners. I mean, that's, pretty common sense. But I think that's probably why the numbers are still climbing.
But even monogamy isn't entirely effective when it comes to stopping the spread of this disease.
We see students sometimes that will say their partner has chlamydia. They know they've been exposed to chlamydia, in which case we treat regardless.
The statistics are that, if a female has had chlamydia, a quarter of those females will get reinfected within that following year.
Lack of communication between sexual partners can lead to passing of the disease between the two.
It's like playing tennis is what I usually tell my patients, that, if one, person X is treated, but Y didn't get treated and they're, obviously sexually active together, it's just, going back and forth.
Another possible reason chlamydia rates are rising may be the use of new screening methods.
And I feel that since it's becoming more easily to test, and the testing itself is easier to bear and go through, I feel that more people are more willing to be tested, and there's a possibility that we're seeing more cases because we're perhaps screening better.
Other factors can also affect the chlamydia rate.
Chlamydia does discriminate. Factors like sex, age, race, and even where you live change the likelihood in which you could contract the disease. In 2015, African American men and women had the highest rate with more than 1 in 100 with the infection. Hispanics fared a little better on this, with a little under 1 in 250 being infected. Whites have lower rates still, with 1 in 500 being infected, and the lowest rates belong to Asians with a rate of only 1 in 1,000. Now let's head over to James with more information on chlamydia rates.
The categories of age and sex both have an effect on chlamydia rates. The rate of chlamydia was the highest in young adults aged 15 to 24. When split into smaller groups, the rate among 15 to 19-year-olds was 1 in 55.5, and the rate among 20 to 24-year-olds was 1 in 39. The rates decrease as you go up in age after this. Sex can also influence your chance. In 2015, there were 1,045,143 cases of chlamydia among females. This makes the rate among females a little more than 1 in 155. The rate among males was less than half of this, with a mere 1 in 327 being infected. The CDC suggests the lower rate among men could be because men who are sexually active are not getting screened for chlamydia. Advancements in technology are already catching more cases in men, as the rate has increased 20% since 2011. The rate among females has only risen 0.3% during this time period. When the rates of age and sex are put together, the highest rates belong to young females. The rate of chlamydia among 15 to 19-year-old females in 2015 was 1 in 33, and the rate among 20 to 24-year-olds was 1 in 27. The rates among men of this age were substantially lower, with the highest belonging to 20 to 24-year-olds with 1 in 68. Your chances of contracting chlamydia changes based on where you live. People living in Philadelphia County, the largest urban center in Pennsylvania, were twice as likely to have chlamydia than people in Cumberland County, the suburban county where Shippensburg resides. The trend prevails throughout Pennsylvania's counties, with the metropolitan areas reporting higher chlamydia rates than in rural areas. These rates take on a greater meaning when we take a look at what chlamydia actually is. Eric Davies has more.
Chlamydia is an STI, or sexually transmitted infection, caused by bacteria transferred during sexual contact.
The misconception is that that you can only get it from penetrative intercourse, but that's not true. So other sexual activities, you can still get this infection.
According to the Pennsylvania Department of Health, more than 3 million people contract it annually. The infection may move inside your body if it is not treated.
For a female, it can be something as severe as infertility, pelvic inflammatory disease, and that may even require surgery, hospitalization for antibiotics, things like that.
The disease can also impact infants born to a mother with chlamydia.
Let's say a woman had it and she had a vaginal delivery of her baby. That can even cause the baby eye infection, pneumonia even.
This infection can also be hard to spot.
It can cause an infection where symptoms may not be noted. Men or women may actually have had contact or have the infection of chlamydia and not know it and not have any symptoms at all.
This infection can have serious effects on both the people who get it and their loved ones, making it something to keep an eye on.
If you are going to be sexually active, it is important to stay safe and use protection.
The best recommendation I can give is to make sure that there's some sort of barrier method. So wearing a condom.
While the use of condoms can reduce the risk, it is not 100% effective.
Condoms will decrease the risk, but I think it's very important to emphasize that when it comes to chlamydia, condoms don't necessarily make sex safe. They're only about 50 to 60% effective at preventing the transmission of chlamydia during sex.
Condoms are for sale on campus, in the Cub, at the Snack Shack, as well as in Eder Health Center. One of the possible reasons for the rate increase is lack of proper screening. Dr. Connor advises all sexually active females who are above the age of 19 to start getting regular pelvic exams.
As an OBGYN, as we're doing the pelvic exams, we can go ahead and swab and screen for gonorrhea, chlamydia, and that's something that females should do on a yearly basis.
Dr. Wellman would also like to reassure males that the screening process for chlamydia is quick and non-invasive. Free chlamydia screening for both men and women is offered at Keystone Health Center in Chambersburg, as well as Eder Health Center.
If a young person is on their parents' health insurance and maybe they don't want to get tested because they're afraid that their parents may find out, it's actually confidential. So even if they're on that their parents' health insurance, birth, contraception, STDs, those are all very confidential that your parents don't have to find out about.
While screening and condoms may be readily available, the best way to stop the spread of chlamydia is simply to be safe.
There are several things students can do to prevent the spread of the disease. One is just good judgment in regards to sexual partners. The incidence of chlamydia increases greatly with number of sexual partners. So that's the first step, is to try to prevent the risk the best they can by making good judgments in that regard.
The only person who can protect you from chlamydia is yourself, so be careful. I hope you have found this SUTV News podcast very informative. Please follow us on Facebook, Twitter, and Snapchat, and check out sutvnews.com for more stories. And I'll see you next time.